everyone, greetings. I am Sania from Beautiful Spotless Skin Team. I am sure all of you must be keeping good health. Hair loss, whether it is hair loss in men or hair loss in women, is a common biological problem all over the world, not just in India. The importance of hair in enhancing the overall personality of a human being cannot be overestimated. Hair is the first thing that people notice about you. A great hairstyle can give you the personality boost you require in doing well in both personal and professional fronts. Hair loss, on the other hand, can prove to be a real disadvantage for many people. Many young boys and girls start losing their hair early in life, caused by a variety of genetic, environmental, and systematic factors. Hair fall can affect everyone, regardless of their country or region. Thankfully, effective hair treatment can control and even reverse the hair loss process. We are here to know more about hair loss, its management, and more in detail about hair care and its management. So let's connect today with our expert, Dr. Niva Mittal, live from Jaipur to make aware on hair fall and its management. Dr. Niva Mittal is a dermatosurgeon, dermatologist, cosmetologist, and hair transplant surgeon. She comes with rich and versatile experience in clinical dermatology and cosmetic procedures, including hair transplant, skin tightening, and anti aging treatments. Her specializations are clinical dermatology, hair transplant surgery, cosmetic treatments like Botox, fillers, threads, laser treatments, and many more. She is a member of Rajasthan Medical Council registered and lifetime member of IADVL. She completed her MBBS from Sardar Vallabhbhai Patel Medical College, post graduation from Shri Devaraj URS Medical College, Kolar Bangalore, followed by observership dermatopathology KEM Hospital Mumbai and fellowship in hair transplant VASA Academy Ahmedabad, and currently consulting at Vaishali Nagar, Jaipur. A very warm welcome to Dr.
Thank you so much.
And Doctor, as we are going to talk today about a very important topic that is the hair loss, about hair management and its treatment, the very first question comes in everybody's mind that why does hair loss occur?
Thank you for the introduction. As we all know that the hair, it is a very important part in the appearance, in your appearance. When there is too much of hair fall, when there is a noticeable hair fall, it people start commenting. Your self-esteem goes down. So it is very important for you to take care of your hair. So there are many different causes of hair fall. I'll just note down a few of them. Like first of all, it can be hereditary. Hair fall can pass down through generations. It can be due to nutritional deficiency, like there is a deficiency of iron or biotin in your body that can lead to hair fall. A deficiency of also multivitamins like vitamin B12 and vitamin D3 is also known to cause hair fall. According when your age also progresses, there is anatomical thinning that is seen over your scalp hairs. Another cause might be if you're undergoing some major treatments or if you're taking some very strong medicines like immunotherapies. So that can also lead to hair fall. Some cancer treatments can also lead to hair fall, as we all know. Some another cause might also be due to some regular hair care and some hair products that you keep on using if you are getting permanent straightening or some products or some therapies done over your hair, or regular hair coloring can also lead to hair fall. Some scalp infections, some scalp eczemas like psoriasis can also lead to hair fall problems. So you need to consult your doctor for so that we can come to a diagnosis as to what is the cause of your hair fall.
Okay, so these are like different causes which can cause hair fall, and as you have mentioned, it can be genetic or using some product as well. Doctor, a very basic question come that who is affected by hair loss, and is the hair loss preventable?
So if we go according to age, uh, Elderly people are more affected by hair fall. As you can see, thinning, there is receding of the frontal hairline. In men, we can see male pattern baldness. In females, we can see widening of the partition and female pattern baldness. And yes, definitely, if the problem is not hereditary, if it is hereditary, then we need to be careful, but you cannot prevent it. But if the problem is not hereditary, if the cause is not hereditary, then definitely, if you take care of your health, if you take care of your mental as well as physical health, you can prevent the symptoms of hair loss.
Okay, so that means hair loss can be prevented if somebody take proper treatment or proper preventable measures.
Right.
Yes. And doctor, I might sure that people might have come to you that my hair is falling like a lot. So how much hair fall is considered to be normal?
So we usually tell patients that around 150 up till 150 to 200 hairs per day. If you feel that that is the amount, approximate amount of hair fall that you are noticing per day, it is absolutely fine and it is absolutely normal, because there is a continuous cycle of hair growth and hair fall that goes on. So according to that cycle, up till 150 hairs per day, if you are noticing that amount of hair fall, it is absolutely normal. Yes, many times you cannot count the number of hairs that are falling, but if you see that you just have some, you are experiencing hair fall only while showering, or only while you have a lot of knots in your hair and you're just combing your hair and a little amount of hair fall, hair comes out, then that is absolutely fine. If you're noticing hair fall, just more than this, like you are having hairs all over your pillows or all over your bed covers when you get up in the morning, or a lot of hair fall while you're taking a shower or when you're massaging or oiling your scalp, or you just have some hair strands in your hair just when you comb your hair with when you run your fingers through your hair, then I think that is the point of time when you need to consult a doctor.
Okay, so that means 150 hair is enough, like a normal, considered to be a normal hair loss.
Yes.
And as you have mentioned that somebody is showering, sometimes hair falls out in the shower as well. So is it like that? That should we wash it less, and how many times in a week should a person wash his or her hair?
See, so approximately the standard number of times that you need to wash your hair is around 2 to 3 times per week. That is the standard. Yes, it depends on the type of scalp you have. If you have an oily scalp, then you need to wash it more frequently, as you do not want the oil to accumulate around the hair strands. That might lead to dandruff and that might lead to reduction in your hair growth. So, according to the scalp, but the standard amount of time is 2 to 3 times per week.
Okay, so that means 2 to 3 times a week a person can wash the hair. And as we are talking about hair loss, sometimes people also, if somebody is using any kind of home remedies or suggested by some of their family members or friend, they applied it on hair. So does home remedies work on hair?
Uh, I won't say no. Yes, definitely they do work. If, like, they can condition your hair. Home remedies, there are masks that you can prepare that can condition your hair. And if your hair is conditioned, knots will be less in your hair and they might break little less. And yes, definitely not once or twice, but if you continue the home remedies, they might provide some extra nutrition to your hair strands and to your cuticles and your follicles that might increase the hair growth.
Okay, that means home remedies works, but sometimes people also use over the counter products. Like if my friend has suggested me something that this will reduce the hair fall, so please apply it. Is that okay? That if somebody is using the over the counter product and we are using the same product, is it suggested?
Uh, it will not be suggested, definitely, because you need to use products that suit your hair. Every patient, every person's type of hair strand, the durability, the elasticity of your hair strand, the scalp. the skin of the over the scalp that you have, the type nature of that skin is different. So you need to use products that will suit you and not others. So people might give you suggestions, but you need to confirm it with a professional before using them.
Right, and I think consulting a profession is much better than using the products and then the result may be worse. And I'm sure many of people have come to you as well. They've applied some or the other products, and now their hair loss problem is
Yes,
occurring
we
again
do
and
get
again.
a lot of patients like that. They come down with a lot of side effects that we use this product and it is not suiting our hair, and there was a lot of hair fall after using the product. So we need to reverse that full circle.
Right, definitely, definitely, doctor. And sometimes people also, curl their hair or straighten their hair or blow dry as well. So does frequent combing or other hair treatment like blow drying, curling, etc., cause hair loss as well?
Yes, frequently using ironing and heating products on your hair will cause hair fall because it damages your hair strands. It removes all the hydration, all the moisture from your hair. It makes them lusterless. There is a lot of drying and damaging breakage that is seen in your hair. Once in a while is absolutely fine, but use products before styling your hair so that you can protect your hair strands from the damage of those ironing and curling products.
That means before using or ironing your hair, you must take some apply some kind of product that can prevent your hair you from hair loss.
Right.
Okay, and when we are talking about the various causes of hair loss, is dandruff can be a major cause of hair loss as well?
Dandruff is one of the major causes of hair loss. People don't understand that if dandruff is there, you need to take proper treatment. If you take treatment for dandruff, your hair fall might just reduce on its own, and you will not need to take any other extra medicines for your hair fall. Dandruff is a major cause. It blocks your pores, it blocks the follicles, and it retards the hair growth. And when your hair growth is retarded, the nutrition to your hair is not supplied. It does not reach the whole length of your hair strand. And because of that, there is breakage and there is lusterless hair. And definitely dandruff causes all this. So dandruff control is a major treatment if you want to control your hair fall.
Okay, so if you want to control your hair fall, if you are having dandruff, it is suggested that you go and treat your dandruff as well, because as doctor mentioned that it is a major cause of hair loss as well. Doctor, sometimes people put accessories on their hair as well. Can accessories like helmets can also worsen hair loss?
So, one of the reasons of hair fall that we've also seen is continuous stress and tension over your hair strands. So, for example, people who drive two-wheelers, they put on helmets. Because of continuous wearing of a helmet, there is tension over your strand, and because of that, also hair fall occurs. So, we advise people to wear some protection between the helmet and your scalp so that there is no direct tension and force over your hair strands. Also, very tight uh, hair styles, like girls who put up high buns with a very tight hairstyle and a very tight elastic. So they might also experience hair fall. And people also who have a similar partition going of the hair throughout the years. So ladies especially, they might experience hair fall in that partition area. So it is always advised to keep on changing the partitions. Keep your hairs a little loose. Do not tie them, make a very tight bun. And also, who wear helmet, they need to protect their scalp first and then wear a helmet so that the friction is reduced.
Okay, so these are the preventable measures for everybody. If you are wearing helmet, you can use some kind of products, as doctor already said. And for the ladies, you can change your partition, and that can also be a cause of hair loss as well. Doctor, as we are discussing about a very important topic, hair loss, there are questions from a viewer as well who are watching these lives. So there's a question from Tina asking, how does the health of my scalp impact hair growth, and are there any specific scalp conditions to be aware of?
The health of your scalp is very important. You need to keep your scalp clean. That is the one thing, because unhygienic, and if your scalp is not clean, you might develop infections. You might develop fungal infections over your scalp. You might develop dandruff over your scalp, and that can lead to hair fall and a retarded hair growth. So you need to keep your scalp clean, continuous washing. You also need to be careful that not to use very harsh products, as they can damage your scalp skin. They can they can just lock in all the moisture, and the moisture does not reach your scalp, your hair strands, and because of that, the healthiness of hair is reduced. So you need to keep your scalp clean. The health of your scalp is very important. You need to know that. Use products according to the scalp skin that you have, and just need to be careful with all the products that you use.
Yes, so clean your scalp and do not use more harsh products on your hair as well. Doctor, here's a question which is that, sometimes, as you have mentioned, that stress and diet can also be a cause of hair fall. So if a person have changed his or her diet, that can be a cause of hair loss.
Uh, Diet change, a sudden diet change definitely causes hair fall. But if you have a very normal and a very balanced diet, which includes lots of ions and proteins, and you have lots of vitamin B12, then definitely you can improve, you can prevent that hair fall, and the hair fall that has already occurred. With a good change of diet, when a diet, not a crash diet, you don't have to stop eating everything just for a weight loss or something. But yes, a good change of diet can lead to hair growth, that can increase the density of your. And I also need to mention stress levels. Yes, it is very important to keep your stress levels under control. Your mental, your physical stress, your mental stress has a lot of impact over your health of the hair. And to keep your stress levels under control, lots of exercise and yoga, meditation can help you deal with your stress levels.
Right, doctor. And sometimes people have stress about their hair loss as well. That my hair are falling, so I am stressed because my hair are falling.
Yes.
So, what do you suggest to those people who actually stress about their hair falling off?
I think a major part in that therapy is just counseling. You need to counsel the patients that it is absolutely fine if you take much more stress about hair fall, they're going to fall further. So it's going to be a vicious cycle. You'll keep on taking stress and you'll keep on having hair fall. So that is the first thing that you need to do, is to stop taking stress and to work towards increasing the hair growth.
Right, definitely. So, before stressing out that your hair is falling, you can do a lot of preventive measures for your hair as well. Doctor, there's a question from another viewer asking, can hairstyles, hair treatments, or styling practices contribute to hair thinning or breakage?
Yes, definitely. When you apply a lot of products, a lot of gels and mask over your hair, it might not suit everyone. A lot of ironing or perming also, a lot of cosmetic treatments that are done over your hair scalp, hair strands, it definitely absorbs all the moisture. It might look good for a few days just after the procedure, but after that, you might start noticing the side effects of the therapies and treatments that you've got done. So, once in a while is absolutely fine, but we always suggest not to do it much more any frequently, and also to take care of your health, to nourish your hairs very generously in between the treatments. that if you're getting treatments done every 2 to 3 months, then make sure that in between the treatments, after you get the treatments, you still take care of your hair, you nourish them properly so that the side effect of the treatments are not much visible.
Right. So, treating your hair properly and taking care of them is the most important thing. If you don't want that your hair can fall apart, and as doctor already said that if you're doing any kind of hairstyle frequently, you should be more careful. Doctor, when we are talking about the causes, symptoms, what are the treatment options which are available for people who are having heavy hair loss?
Okay, so when you consult a doctor, the first thing that they will do is to assess what is the cause of your hair fall. If it is hereditary, you might be counseled according to that for the treatment options. If it is according to any kind of any temporary cause, like you're taking some medicines, or if you're very sick, you have a lot high grade fever, if you've developed typhoid or malaria, so you might experience hair fall after these fevers, after these conditions. This type of hair fall is always reversible, so you can take treatments, very temporary treatments that might need some extra nutrition and supplements to your hair to for your hair growth. And if the causes are a little more permanent, like you have some internal hormonal problem, or if you are taking some cancer treatments, you might develop hair fall that is much more permanent. So, treatment options that are available, we have a lot of medications and a lot of solutions that can be applied on your hair. We have stem cell therapies, we have platelet rich plasma therapies that can be done for increasing the density. And lastly, we can go in for hair transplant options. And if that is also not possible, you can definitely go in for some camouflage treatments like a hair wig or some hair patches.
Right. So that means there are various treatment options which are available if somebody is having severe hair loss as well. And as you have mentioned about the transplant as well. So when should a patient with hair loss go for surgical treatments like transplant?
Uh, Surgical treatments like hair transplant are usually done when the hair fall problem has excessively past that line when you cannot increase the density of your hair just with normal medications and stem cell therapies. Usually, hair transplant is done when the follicles over your scalp have also reduced in size. When the follicles have disappeared, there are no follicles which can be targeted with the PRP therapies or the medications. So, if there are no follicles, the hair will not grow. So, hair transplant treatment needs to be done at that stage when we can implant the follicles over your scalp, and that can lead to hair growth.
Doctor, sometimes people also have genetic baldness that, it is that my father used to have the bald hair. That's why, so is it like that, that hair loss or hair fall is genetic? And is there any treatment for genetic baldness as well?
Uh, Definitely, there is a treatment. If you have a genetic and a hereditary condition, hair loss can definitely be postponed, and it can be targeted. Like, you cannot get that hair fall till the next 10 to 15 years. So we can definitely delay that process of the hair loss. Again, as I mentioned before, the treatments that are available that can be done, they can delay the hair loss problem that you might have in the future.
Okay, doctor. And as we are discussing hair loss, its symptoms, prevention, about the treatments as well, there's a question from a viewer asking, what is typical rare of hair loss, and whenever should I concerned about excessive shedding?
Uh, Typically, when you start seeing your scalp, when you feel the difference, a sudden difference in the hair density and in the hair quality of your and in the hair quality, that the quality of your hair has reduced, there is no shine, there is no luster, and the density has reduced. There is in between breakage of your uh, hair strands, or the hair strands are completely coming out with the roots. So if you start noticing such changes over your scalp, you can definitely consult for treatment options so that that hair fall can be stopped at that particular time.
Right. So that means excessive hair loss, if it is there, you should definitely go and visit a doctor because it can be a problem as well. Doctor, sometimes people also use OTC product like anti-hair fall shampoo and serum for controlling hair fall. So does that works?
Uh, they do work sometimes, but they are just an extra uh, management option. They are not treatment for your hair fall. So if you are using some OTC serums for your hair, they might condition your hair so that you don't get frequent knots, and that will lead to breakage of your hair. They might condition your hair. They might clean your scalp properly, but they are not treatments for your hair loss. They are always an extra supplement, an extra line of management in your hair loss treatment.
Okay, that means if somebody have suggested you, or if you are using that particular product, that can be just for some time. It can prevent the hair loss, but it is not treated from the root. Is it like that?
Yes. Yes, it's not a treatment. It can just provide some extra nutrition to your hair, but it is not a treatment. So you might not notice a complete stoppage in your hair fall. You will definitely need to see a doctor and take some proper medications for the same.
Right. And doctor, as you have mentioned about the medication, is it like that sometimes people have hair fall? They also take some kind of medicines to prevent the hair fall. Does medications work as well?
Medications definitely work if you're taking multivitamins, if you're taking extra biotin supplements. There is an extra nutrition that is provided to your hair follicles from your blood circulation. And when that extra nutrition goes to your hair follicle, it definitely makes the root of your hairs more strong. So this hair fall cycle can be reduced and the hair growth cycle can be increased with extra medications and supplements.
Okay, okay, doctor. There's a myth as well, that girls have more hair fall than the boys, and they should not take proper care of. Usually, boys don't take care of their hair more than the girls. So, what do you suggest the prevention methods for the boys as well?
Uh, it's not a myth, in fact, because girls usually have longer strands, and because of the longer strands, little management of your hairs, or you need like a lot of products over your hair to manage them. There are a lot of knot formations because of longer strands, and because of the knot formations, hair fall and the hair breakage increases. That is not seen in boys, and because of shorter hair strand length, the density is also see, it seems full. Your hair seems full because of a shorter hair length. So that is the thing. Because of that, boys might experience lesser hair fall, but yes, it is not uh, like that ki, the boys might not develop any kind of baldness. Boys definitely develop male pattern baldness gradually. So they also need to take care of their scalp. They need to keep their scalp clean. They need to use a conditioner. Definitely boys can use a conditioner to keep their hair strands soft, so that there is no breakage, much more breakage of their hair strands.
That means boys should also take care of their hair. It is not like that only girls should take care of their hair. Boys should also take care of their hair because, as you said, doctor, that in the later stage they can also develop baldness.
Right.
Okay, and there's a question from a viewer, doctor, asking, can hormonal imbalances contribute to hair loss, and how can they be addressed?
So that is one of the important things again, hormonal imbalance. especially seen in ladies like PCOS syndromes and even thyroid abnormalities. It definitely needs to hair fall. uh, because of the hormonal imbalance, you can get weight gain, your diet imbalance. Because of the diet imbalance, there is an hormonal imbalance in your body, and that can also lead to hair fall. So, and again, stress levels lead to hormonal imbalance in your body, and due to which you can see hair fall. So, keeping your hormones checked, keeping your hormonal balance. For that, you need to maintain a proper diet, you need to maintain a proper exercise schedule, you need to maintain proper stress levels. Your stress levels need to be down. If the hormones are in balance in your body, it will not affect your hair growth cycle a lot, and the hair growth will be proper and there will be reduced hair.
Okay, that means a proper diet, a good diet can always help. And as you have mentioned, doctor, that exercising can also prevent hair loss.
Yes.
So, good exercise, good dietary plan,
It
eating
leads,
good.
yes, it leads to a good nutrition. Nutrition is always proper, and it is very important in your hair growth. So when you exercise continuously, the blood circulation improves in your body, and because of that, a lot of nutrients that are required for your hair growth reaches the scalp, reaches the hair follicles, and hair loss is prevented.
Yes, so eating good, eating nutritious, as a doctor said, is very important for your scalp as well. So make sure that whenever you are seeing such kind of hair loss, or your friend, do suggest that eat properly, have a good diet, and exercise as well. Doctor, sometimes people also, if they're taking any kind of medications for hair loss, and if they are facing a kind of hair loss problem, they do not take the full medications because of many reasons. So, any message to all the people who actually don't treat their hair loss properly, and they left it in the between only?
Right. So treatment of hair fall is it goes on for a very long time, to be frank, because the hair growth cycle is a very slow cycle. It the treatment usually takes around 40 to 45 days to be visible. So you need to have a lot of patience. Compliance is a problem when we are managing hair fall. So we always counsel the patients to have a lot of patience with them. They need to generously apply the medicine. They do not have to skip their medicines. They do not need to skip their lotions. It takes time, but if it is done properly, with the medicines, with your diet, with your exercise, so definitely you can see a result with the medicines. But yes, do not stop your treatment in between. It will be a waste of time, it will be a waste of your money, it will be a waste of your energy if you stop the treatment in between, as you will not get the desired result that you want.
Yes, right. And as it is said that good things take time, so make sure that if you are treating your hair loss problem, the signs or the symptoms will disappear in a while. As doctor said, I think doctor people also want instant results. That if I'm taking such kind of medicines or nutrition, my hair should come again. But I think, as you have mentioned, that it is a slow process, and you need to be patient. And if you are having any such kind of problem or symptoms, hair loss, you should definitely go to a doctor. Do not self treat it. Sometimes, doctor, I am sure that you might have come across some people who have self treated their hair loss, and now they are having more hair loss than earlier.
Yeah, so I think internet surfing is the main cause for that. People surf their problems, they find out the solutions on their own, but we need to treat the cause also. If there is an infection or if there is a nutrition deficiency, your doctor can only diagnose that, and only a doctor can give you proper treatment, so that even internally the cause of your hair fall is treated, and your hair fall reduces. If you just internet surf your problem and you just treat it superficially, you will not get the result. and you might have some side effects also, because you do not know the entire procedure, or you do not know the exact cause of your hair loss. So please get yourself diagnosed first as to what is the cause of your hair loss, and then get a proper treatment.
Right. So do not self treat your hair loss problem, because the doctor better know that what is good for you and what is not good for you. Doctor, any advice you would like to give to all the viewers who are watching this live?
My only advice is, do not take hair fall lightly. If you are noticing any kind of hair fall, and if you feel that something is not right, make sure you listen to your guts, you go to a doctor, and you get yourself treated before the problem worsens. And if the problem worsens, it is definitely difficult for a doctor also to treat it. It takes a lot of patience, it takes a lot of time. So please go to a doctor as soon as you feel like there is decreased density, there is scalp that is visible of your hair. And please trust your doctor, they will always give you proper medication. They will treat you from all the points and not only superficially.
Right, definitely. So, as doctor said, do not treat your hair loss by yourself, and also do not ignore your hair loss problem. If you are having any kind of hair loss problem, do go to a doctor, because they know better. And as in this amazing live session, we have discussed about the various treatment options, what are the types of hair loss, why hair loss is a major problem in boys and in girls as well. Doctor, before we end this very informative live session, any takeaway message for all the viewers who are watching this live?
Take care of your skin, take care of your health, take care of your hairs. It'll boost your confidence a lot if you look good and if you feel good. So take care of yourselves, and you will be beautiful.
Yes, wow, what a beautiful message, that take care of yourself. You will definitely increase your confidence if you look great, your hair look great. Do not ignore hair loss problem, because it is very important that you do not self-treat the hair loss problem. You treat it by a doctor, go to a doctor. And I think this is an amazing informative session for all the viewers as well. So I would really like to thank you, Dr. Niva Mittal, for your valuable time, and it has been a very informative session for all our viewers, and it is so great to hear you.
Thank you so much, Sanya. Thank you for this opportunity. And I'm grateful for the help, whatever help I can do.
Thank you so much, doctor, and we really look forward for many more sessions in the coming time as well, doctor.
Yes, same here.
Thank you so much, and thank you so much, all the viewers, for your excellent participation in today's session. Stay connected, and good day to you all.